What causes cancer? What increases a person's chance of developing cancer? That's a very complex question. But the good news is that science and research has identified certain things that can increase a person's chance of developing cancer. That's what we mean by risk factors. I want to point this out. Sometimes people are exposed to these risk factors and they do not develop cancer. On the other hand, some people have never been exposed to the risk factors, but they develop cancer. So we're still at a point where, yes, we understand what can cause cancer, what can increase the risk of cancer, but most times we don't know what causes cancer. So leading causes of cancer are heavy consumption of alcohol, smoking, and smoking in all its forms, from snuff to the cigar, to the pipe, to the shisha. Anything that contains tobacco is a risk factor for developing cancer. It doesn't matter how it is inhaled or ingested. And this is because tobacco contains several components and chemicals that are known to cause cancer. Another leading risk factor for developing cancer is the type of food you eat. Diets low in vegetable fiber, diets high in fat can increase your risk of developing cancer. Certain viruses and infectious agents can increase your risk of developing cancer. HIV, known as human immunodeficiency virus, hepatitis B virus, and human papilloma virus are viruses that are commonly associated with certain types of cancers. Like HIV, for example, causes Kaposi sarcoma, a skin cancer that is common in the HIV population. Human papilloma virus is 99% present in cervical cancers. Human papilloma virus is a virus that is transmitted during sexual intercourse, and it persists on a woman's cervix for 10 to 20 years and can cause cervical cancer. Hepatitis B virus can be transmitted through sexual intercourse, blood transfusion, exchange of needles, mother to child, and it is known to cause liver cancer. So a common question we get on the Oncopadi app and from the community is around radiotherapy. Will I need radiotherapy as part of my cancer treatment? Radiotherapy is a critical treatment method in cancer treatment, and there's not enough awareness on the benefit of radiotherapy. But I must tell you that more than 60% of people living with cancer require treatment with radiotherapy. Now, radiotherapy is a useful and effective treatment option for the common cancers that affect a lot of people: breast cancer, cervical, prostate, colorectal, head and neck cancers. Radiotherapy is essential for managing these cancers. So what is radiotherapy? It is the use of powerful radiation to damage or kill cancer cells. There are two ways. There's the external, when the radiation is coming from a huge machine. We call that external beam radiotherapy because the ionizing radiation, the powerful radiation, is coming from outside going into the body. The radiotherapy machine is able to direct the light right into the body. That's why we call it external beam radiotherapy. On the other hand, we have the internal beam radiotherapy, or better known as brachytherapy. This method, we insert the radiation into the body, into a cavity, and then we activate the radiation to, come out right inside the body. I want you to note that radiation, you can't see it, you can't feel it, you can't smell it. The therapy radiographer, a radiation professional, will ask you to lie down on this huge machine, lie still, and then they would run through their processes, which you will see along the way. But what's important is when you start treatment, you just have to stay still. It is a painless procedure. You don't feel anything. It's invisible. Let's talk about how common cancer is. Cancer is a worldwide issue. Millions of cases are recorded every year. In Nigeria, for example, in 2020, 120,000 new cancer cases were diagnosed. Sadly, in Nigeria and many low middle income countries, a lot of patients are presenting with advanced disease. This means patients are presenting at a stage where the cancer has almost overwhelmed the body, and this is why we preach early detection. If you notice a breast lump, if you notice abnormal vaginal bleeding, if you notice any symptom that has been on for more than 3 weeks, you should present to your doctor. Cancer in Nigeria is a crisis because there are many bottlenecks. Number one, people living with cancer are not diagnosed early enough, and when they are diagnosed, for them to find the right cancer doctors, it takes a while, a very long time. And sometimes they find the right cancer doctors, but they have to wait for a long period of time to start treatment. And sometimes they start treatment, but they can't afford to complete treatment. So there are many bottlenecks in the system. And one thing is for sure, that we all have to come together to close the cancer care gap. And one of the ways we are doing this is through the Oncopadi Cancer app, which is a friendly cancer app for you. If you have questions about cancer, you can download the Oncopadi Cancer app on Play Store or App Store, and almost immediately you'll have access to oncologists, cancer professionals, specialists that you are interested in talking to or getting a second or third opinion. You can report your side effects. You can join a community of other people who are going through cancer or have gone through cancer many years or decades ago. Cancer is a troublesome disease. Can you change that in this moment? No. What you can change is how you approach your care. Can you start care early? Can you find the right cancer doctors? Can you raise funds for your treatment? Can you adhere to medical advice? It's fantastic when you have a support system from your family. This is not the time to hide a serious condition that is affecting your health from certain members of your family. It's also not the time to tell everyone what you're going through, but one thing you can do is identify the right people who will support you on this journey. And Oncopadi Cancer app is always in your mobile phone, on your laptop, your computer, any of your internet-enabled device to support you on this journey.